Hello, my name is Dan, and I am a monitor for about 20 years. And I think there are two things that I think are really important for monitors to do excellently. And the first one is the inspection and review of signed and informed consent forms. So I want to share with you the checklist that I use when I look at a signed consent form. Okay, column D here is the ICF version. So my experience has been that the consent forms are sometimes labeled in 2 or 3 different places. Upper right corner, lower right, and lower left. I typically write them all down because I don't know which is meaningful for the site. Okay, the next one here is the ICF that was signed, the current version. So what I do is I go to the IRB section of the reg binder, and I find when the most recently reviewed consent form was and what it's called. I had a situation that the site had an electronic connection with the IRB that they could download a consent form, but they also printed the consent form and put it in the reg binder. And sure enough, the site used an expired consent form. So another thing is just find out what the site's process is for getting the current form. Let's see, the next one is when is the first date that the subject had the opportunity to sign the new consent form? So in another video, I'll share with you how I use timelines, but what I need to do is find out when the consent form was approved by the IRB and then notified to the site staff, and find out whether the subject signed that new consent form at the first opportunity or whether the subject didn't sign it, but the IRB had approved it. This next one is the form, the original form. Are all pages present? Typically, the consent form will have something like page X of Y, and I make sure that they're all there. And the next one is I make sure that all of the pages are for the same consent form. I've actually had several consent forms sort of bundled into the same package that the subject signed. So, did the subject sign it? That's an easy one. Let's see. I capture the date and the time that the subject signed the consent form if this is captured on the consent form itself. Is there documentation that the subject signed, that the subject speaks English? So I had an interesting experience at a large academic center in New England that sees a lot of foreign subjects, patients. I was lucky that in the progress note from the either coordinator or the PI that the subject does not speak English. I think the subject spoke an Asian language. Well, sure enough, the consent form was in English and it was signed. And that's why I have this column in here. If you're in doubt whether the subject speaks English, ask for documentation if the subject does speak English. Let's see, compare the subject signature with other signatures on other ICFs that the subject signed. So I've heard horror stories about site staff signing consent forms for subjects. So clearly, all of the subjects' signatures should be the same. If they're not, you need to do an investigation. Color of pen, I forgot why. Let's see. Okay, so what I do here in column R is I go through the schedule of assessments or events and find an assessment that probably is not done as standard of care. For instance, for cancer subjects, getting an EKG is not too typical, but for clinical studies, it is. So I find out what assessments are probably unique to the protocol, find out when the subject has had them, and then compare that date to when the consent form was signed. Because sometimes the site staff will have the subject come in, do a whole bunch of procedures, and then go see the coordinator and the doctor for the consenting. Clearly, that's not the right sequence. So you need to do an assessment for what procedures were done and when. I capture the name of the person who did the consenting for my own records. Now here's a big one, and that's why I've highlighted this in red. Is the person who did the consenting authorized per the responsibility log to consent? That person should be authorized. Then I compare the signature on the consent form to the signature that the staff person entered on the delegation log. Almost always in the delegation log, there's a separate column for signature and initials. I want to make sure that they're the same. Frequently in oncology, there are options that the subject can pick from. That's for this. Then I have a section here for the documentation of the consenting process. There are basically three things that are necessary: that a copy was given, that no study procedures were given before consenting, and the subject was asked, had the opportunity to ask questions. I also capture whether there's documentation of eligibility by the investigator. Some CROs and some sponsors want that, and these are optional ones. So that's it.